Good afternoon, everybody. Welcome to our media briefing on COVID-19. We're happy that you are here and joining us to get up-to-date information on what's happening in this community and what we are doing to respond. It's Wednesday, May 26th, and today is Wednesday, May 27th. I have a little typo in my notes, and we are happy that you are here. I'll give you some state updates and then some Eau Claire updates on data and share some new things that are happening in the community and then be available for questions. First of all, state status for our cases. We have now 210,605 negative tests for COVID-19 in the state, an increase of 9,700, more than 9,700. Positive cases of COVID-19 by testing are at 16,462 for the state, an increase of 599 since yesterday. 2,411 people have been hospitalized for COVID-19 in the state at any time. About 15% of our hospitalized have been hospitalized of our positives. And now 539 people in Wisconsin, residents, have died of COVID-19, an increase of 22 since yesterday. In Eau Claire, we have 4,528 tests that have been done for COVID-19, an increase of 72. Some are remaining as pending, and we will get those results shortly. Negative tests are 4,312. We now have 104 individuals that have tested positive for COVID-19, Eau Claire County residents, an increase of 1 from yesterday. We do have also 4 probable cases of COVID-19, and that is a new data metric that we are tracking. Probable cases are not yet on the state website or on the local website, but it's something that we're paying attention to. Those probable cases are ones that are connected to a case but have not had a test and are going through the same precautions that we do for all cases of being isolated at home for the duration of their illness. Released from isolation, we are now at 77 individuals of the 104 that have been released from isolation. Again, the website reports slightly different numbers because those are a delayed number from what we have. So our website is reporting 64 released from isolation and a smaller number of positive tests. But again, our current numbers are 104 positive, 77 of those have been released from isolation. There are 3 public health investigations that have happened in Eau Claire County. Only one is new, that is at a long-term care facility, and that is newly posted on the state website. People in skilled nursing facilities are our most vulnerable population. That's part of why the state has been posting those. And again, it's important to note that the presence of COVID-19 doesn't mean that the long-term care facility is doing something specifically wrong or not following procedure. It does mean that there's been a positive test there, and they are working with us to assure that those numbers do not grow. We have an amazing group of long-term care facilities in our community, and we are daily impressed with not only how they are partnering with us on testing and on disease control measures, but also on working with us to make sure that this vulnerable population is protected in many, many ways. Today, the governor announced that $200 million will be available of the CARES funding to every Wisconsin county, city, and village, as well as the towns and federally recognized tribes in the state. Again, this is a distribution of some of the CARES funding, the federal dollars. It is for unbudgeted expenses related to COVID-19. I'm certain we will be getting more detailed information about that, but all of the cities, villages, and the county in Eau Claire are part of those dollars that will be going out. The state has indicated that those are for unbudgeted expenditures such as emergency operations, PPE, isolation and quarantine, testing, contact tracing, and other functions. Locally, last night, the City of Eau Claire, the council voted to extend the public health declaration. Dale Peters, our city manager, talked about this at a previous media briefing. But that declaration will now go until June 23rd. That declaration is in place for the city to have a tool to do some specific things as city government to make sure that they have some flexibility. The extension of that emergency declaration, for example, allows us to use the Hobbs Ice Arena for a specific housing need that we have in our community related to COVID-19. It also allows things like having bus fees waived and having the waiving of the late fees for utility bills. All functions of the city allowable under that emergency order. We also will be having a new public health order. We want to be clear to differentiate between the city emergency order, I know there's been some confusion about that, and the local public health order. Our local public health order went into effect once Safer at Home was over. We started that on May 14th. We had an updated order on May 18th. That was the additional public health order. In those orders, we really focused on risk. We've talked about that a couple of times at our media briefing, but our orders, different than the state order, was really to focus specifically on risk and mitigating risk related to things like physical distancing in businesses and related to mass gatherings. Again, it's a risk-based model related to requirements and the size of those public gatherings. Past updates and future updates, as we have indicated, are really related to public health principles and changing an understanding of this disease course as it is a new disease, and public health data. I'll be talking about each of those items. We've spent the last couple of weeks since the last order was put in place really working through how we would look at data locally, how we would look at regional and state data, as well as how we would progress in looking at moving forward as a community. Some of the data that we will be tracking and have been tracking, data that will be available on our website shortly, and that we will be looking at to say, are we doing well enough to be able to continue to move forward with safely having society return to a more normal state. Some of those disease items and capacity items that we'll be tracking, I'll share with you right now. 3 different data tracking indicators: disease spread and disease status, our healthcare capacity, and our public health capacity. So under disease spread, we're looking at the percent of all of our tests that we do for COVID-19 that are positive. That's that positivity rate. We're also looking at the number of positive tests and whether that's increased or decreased in the last 2-week time period. So spacing that out over 2 weeks to look at it, are the numbers of positives increasing? And are we having new large public health investigations or outbreaks? All of those 3 things I think are logical to people that we are needing to track to see how the disease is spreading in our community. Having the curve be as slowly increasing as possible is one of our goals with both the order and with our recommendations for disease control. That slow, controlled growth is so that we don't overwhelm our healthcare system capacity and that we don't overwhelm our public health capacity. What you need from both our healthcare system and the public health system as a resident in Eau Claire County is that we can contain disease as quickly as possible and we don't have disease spread happening so rapidly that people can't get treatment. Our healthcare capacity measures will be, can we test everybody with symptoms? Can we routinely test healthcare workers that are caring for COVID-19 patients? And do we have hospital resources that are not being stretched due to caring for COVID-19 patients? For public health capacity, we are looking at, are we able to let the people who test positive for COVID-19 know that they are positive within a day of their test result so that they can isolate? And do we have a lot of cases that we don't know where they got sick from? Are we also able to make sure that the contacts to cases are contacted within 48 hours of being identified as a contact? So again, containment of disease measures. We will have those measures dashboarded on our website, and those will be available shortly. We also are working with a regional and a statewide team looking at measures, data measures that are available at the regional level as well as at the state level. Important for all of us to understand that looking just at our data and just at our capacity is not sufficient. Our capacity is related to people that come into this community and people that use the healthcare resources in this community, and the disease will spread. So just looking at Eau Claire is not sufficient as we plan forward. We are looking at that data, and we looked at the order to make some changes to the order. Our data right now is showing us that it's important that we continue to control the spread of this disease. We also recognized by reviewing public health best practice that there were opportunities to do some additional changes. So the order that will start after this current order expires at midnight on May 28th, which is tomorrow, the new order will have lots of same items in it, but a couple of differences, and I'll walk through those. The new order will be posted on our website for people to review in detail. What stays the same are the requirements for businesses, public spaces, and buildings, previously under number 2 in the order, actually still under number 2 in the order. Those businesses, public spaces, and buildings, as well as the personal one-on-one services, have the same requirements that were listed previously. There's a requirement to maintain social distance, physical distance from others when you are out of your home, and a recommendation to stay at home as much as possible to minimize travel and to keep your contact circle as small as possible. There remain the recommendations for elderly and those that are more vulnerable to keep their circle very small. And there remains the requirement for public gatherings for those that are indoors to be no more than 10 individuals. What's different is public gatherings outside or outdoors are now permitted to have 20 individuals. Public gatherings are defined as those planned events, again, with the intention of assembling a number of people for a prolonged period of time for a shared purpose. Again, as the order previously indicated, things like movies, concerts, conferences, sporting events, lessons, those types of activities, as well as social gatherings. People organizing public gatherings are now required to have information on attendees in case there is an outbreak because of that public gathering. We need to be able to notify those people quickly in order to do the case investigation and contact tracing work that we're required to do in this public health epidemic. So we really need to make sure that we can, in those gatherings, reach people quickly. We also have some small tweaks to language to make it more understandable. We had missed some language around incidental contacts being allowable in that 6-foot distance, and some of those changes are small in the order. Again, the rationale of this order is that based on public health principles and data, we are looking at how to keep this community safe, something that people are expecting of us and something that we need to have available to stop the rapid spread of this disease where we can't control our response. Public health principles, again, tell us that large gatherings and situations where physical distancing can't be maintained are places where we've seen across the world this disease spread in a way that is not safe. An additional item to share with you is that testing strategy is being looked at across the state. Both community testing as well as specific facility testing is something that the state is working through. As we know, in order to make sure we contain disease, we have to do good testing as well. It's been a plan from the state to do widespread testing in high-risk settings, including long-term care facilities. Long-term care facilities in Eau Claire County have been working with us the last number of weeks and working with the state to make sure that they can meet the state goal of having all long-term care facilities have testing of both their staff as well as their residents. That has all happened or is happening this week in the long-term care facilities in this community. Across the state, the goal is to have that done this month yet in all long-term care facilities. So we're pleased that that's happening. It will provide a good baseline for us and for the facility to know where they're starting at with COVID-19. So in closing, I would say go to our website. There's good information there. That again is covid19eauclaire.org. If you are an individual or a business owner, that's a place you can get good information on what is currently happening with COVID-19 and how to prepare yourself and to respond. You also can call the call center if you would like additional information. That number is 715-831-7425. Again, thank you to everybody in Eau Claire that's working hard to stop the spread of this disease in ways that are not controllable. So keeping physical distance, washing your hands, and staying home when you're sick. I see that happening over and over in this community, and we all need to thank each other for taking those measures that will make a difference. We know we will see increased spread of COVID-19 in Eau Claire, but we all have a responsibility to help slow that down. So thanks for the work you're doing to make that happen. So I'm now available for questions. Yes?
The new order that's starting tomorrow night, is that also going to last 2 weeks?
Yeah, so the question is related to the length of the new order. We did make the decision to do a new order every 2 weeks at this point in time. It's logical that the community expects us to be regularly looking at the data, regularly looking at best practice. It made sense that we, every 2 weeks, update the community on where we're at with both the data and best practice, and so that decision was made to do another 2-week order ending June 11th is correct. Yes?
Under the current order, playgrounds are authorized to be open. We haven't really seen many open. Can you just talk about the requirements?
Mm-hmm. Sure. The question is related to playgrounds being opened and what the requirements are for a playground or any other entity to meet in order to be open. Again, in this community in Eau Claire, there are very specific requirements for public spaces under number 2 in the order. And any business, organization, public space that can meet all of those requirements in number 2 is able to open, and those that are not able to assure those things are not able to be open. Playgrounds in Eau Claire and in Eau Claire County in many places are not able to assure that all of the physical distancing, cleaning, and other requirements can be met. And the decision by those communities has been to right now keep those closed. The state recommendations and the federal recommendations remain the same, that in those places like public parks where their equipment, their people are supposed to be close together, where that can't happen and can't be observed or monitored carefully, the recommendation by other state and national entities is also to keep those closed. Our order would allow it if there's a way to assure that those basic requirements are met. Sure. So the question was related to pending cases, and I know this can be confusing to people, so not to make it more difficult for everybody, but we do know that the state does have a category, and we are part of the group that has that are pending cases. The pending cases do include cases that are not confirmed with tests. So pending can be those tests that have not been, we don't have the results yet. They're still processing them in a lab. They may be cases that are not tested but are probable cases. And there are some cases that results are coming back, but just timing-wise, we haven't moved them into our electronic system to do the follow-up. So it's for all kinds of reasons. Yes? good question. So the question is why the change from the 10 people for public gatherings, which was uniformly applied in the last order, to separating out outdoor gatherings from indoor gatherings and a requirement of 10 or fewer in indoor gatherings and 20 or fewer in outdoor gatherings. The public health evidence we are gaining as we have more time with this disease being present is that the spread of the disease appears to be less in situations where physical distancing can be maintained and people are outdoors in those settings. And again, for public gatherings, it's still required that you maintain physical distance. But in settings where physical distance and being outdoors can be maintained, it's less likely that the disease is spread than in situations indoors where those same requirements are met. So it was determined that in those settings, because there's a bit less risk, more people could be involved. The number is still small because we're building our public health capacity to respond to disease. So the risk isn't eliminated in either of those situations when you have a group of people together, whatever size, and they are in a sustained way together, the spread of disease is possible, and that's why we've separated out public gatherings from all other types of situations. A grocery store shopping trip, for example, you may encounter more than 10 people while you're grocery shopping, but you're not standing in one place as a planned activity together for a sustained amount of time. So again, outside, the risk is a bit less based on the public health science. Inside, the risk is a bit more. So we decided to make that small adjustment in the order at this point. Yes?
Just have another question for you. We're wondering why there seems to be a discrepancy between the county numbers that we get from you guys every afternoon and then the state DHS numbers that are reported at 11:30. Is it just, they seem like they're always a day behind. Is that just because they pull it at a different time of the day?
Yeah, so the question is about the discrepancy in numbers. The state DHS site, which then we pull down into our local site, are different than what I often report to you on a daily basis, and that's really based on timing. So the data that is pulled by the state is pulled at a point in time, the day, 2 days before, basically, and posted the following day once they clean the data. Our data is real-time data from the nurses and the staff as they are doing the collection of cases. So we literally walk up here with whatever is currently the number of case count that is being worked on. Some of those won't be documented in the system for another 2 days, frankly. So the most current number is the one that I report to you when we get together, but the disease is tracking over time, and at least everybody gets a good idea on the website about what the progression of the count is. Wonderful. So thank you very much for being with us today. Again, we will be back on Friday to give you an additional update, and thanks for all the work that everybody is doing to respond to this disease.